Ohio classrooms will be closed until May. Could parks across the state be next? Thanks so much for joining us. I'm Tanya O'Rourke. The governor making one order official today and teasing that another is coming. Evan Millward continues to follow the developments out of the Capitol. He's standing by live for us tonight. Evan?
Yeah, Tanya, that decision to keep classrooms closed until May 1st comes as the original order expires at the end of this week. Now Governor DeWine says his administration is working on an order about parks because of concerns about distancing, but that is still a day or so away. We also learned today some new information and new numbers about how our hospitals in Ohio are doing in the ramp up here. Dr. Amy Acton showing this graph of capacity for critical things like ventilators. You can see statewide 30% are in use right now. 54% of beds are being used. She told us today she and the National Guard are now preparing to double the state's current capacity.
Now, I promised that when the National Guard had a new mission or we were going to be in your communities, that I would tell you. So I'm telling you, you're going to see service members in uniform in your community doing things in increasing numbers here in the very near future.
That message from Major General John Harris of the Ohio National Guard there. He said those service members will be working with health and hospital leaders in getting things set up for a so-called surge they expect to be coming to their hospitals. And on this National Doctors Day, Dr. Acton told medical personnel she is thinking of them every time she wears that white coat. And she also told us, sadly, one emergency room nurse in Ohio has died from complications from the disease, though she declined to say where that was. We're live tonight. I'm Evan Millward, WCPO 9 News.
All right, Evan, thanks so much. So the city of Cincinnati is furloughing 1,700 in fact, employees today as the city faces an $80 million budget deficit, all because of COVID-19. The mayor says this is only temporary and the employees will return. Reporter Marielle Carbone is at City Hall. She's breaking all this down for us. Wow, some tough words today, Marielle.
Yeah, it was clearly an emotional decision because Mayor John Cranley actually tearing up, choking up today when he was reading the email that he sent out to all of his city staff members explaining just exactly what is going on. And just to put this into perspective, there are about 6,000 people that work for the city. About 30% of those people are affected by those furloughs. So we're talking about 1,700 people are now being affected by this. Now, the mayor says that their salaries in total make up about $40 million annually. As far as those that are affected, he says no sworn officers, so no police or fire are being furloughed, but different administrative people, secretaries within those offices are being affected. He also says across all other city departments, they are feeling this. City departments taking about 50% of their employees being affected by this. So the mayor says that this is a big deal. This is extreme measures they're taking, but he says we will overcome this together because of the dedicated people that work here for the city.
With the help of your dedicated service, Cincinnati has made a miraculous turnaround in recent years, and we will bounce back faster than other communities. And we will bounce back together once it is safe to come back to work. I promise you that we will get through this together. This is only temporary. You will be back.
Now, both the mayor and the city manager say that they are taking 10% pay cuts during this time, as well as some other major department heads. And this is expected to last about 4 weeks. It's going to go into effect as of next week. But again, this could go longer depending on what happens over those next 4 weeks. Now, we are expecting to have a special session on Wednesday, both with the full city council as well as budget and finance, to dig into these numbers and what it means here at City Hall and for our entire city a little bit deeper on Wednesday. But for now, reporting live from City Hall, Marielle Carbone, WCPO 9 News.
Marielle, thanks so much. So the city took additional steps today to combat the spread of coronavirus, shutting down multiple transportation systems until further notice. Among those, the Cincinnati streetcar, which had continued to run throughout the last 2 weeks as other public transit systems scaled back service. WCPO 9 News transportation reporter, Pat LaFleur, has been following this today. He's joining us now from over the Rhine. Pat, what did the mayor have to say about this?
That's right, Tanya. Now we're at the streetcar stop here at Findlay Market. And, you know, starting tomorrow, we're not going to see any streetcars coming by here. And that's because amid both public health and city budget concerns, officials announced today that they'd be stopping Cincinnati Bell Connector service until further notice. Now, part of the rationale in closing the streetcar traces back to a looming $60 to $80 million budget gap expected as a result of the coronavirus. Mayor John Cranley said today all city resources need to be focused on critical services like police, fire, and water. But even more so, he said, the decision was made to protect public health.
We are closing the streetcar during this time to protect the public from increased exposure risks to COVID-19, which can survive on metal and other hard surfaces that are routinely used by streetcar riders. Similarly, we are shutting down bike share and scooters because it is nearly impossible to ensure that they are clean between each ride.
Now, as you just heard, the mayor said that they're shutting down our bike share, that's Red Bike, as well as electric scooter rentals until further notice as well. He did mention that Cincinnati Metro bus service is still going and recommends anyone who uses these services take the bus instead. For now, we're reporting live from over the Rhine. Pat LaFleur, WCPO 9 News.
All right, Pat, thanks so much. So remember, folks, we are here to help you stay up to date on the fight against the coronavirus. Find the latest developments even when we're not on the air. You can find them on WCPO.com. We have a coronavirus section. There's a click. You click on it. It takes you to it. It's at the top of our homepage. So tips led police to an 11-month-old this afternoon taken moments after a shooting in Westwood. The accused shooter is the boy's father, who tried to hide with relatives who opened their doors to investigators. Larry Seward is live in Westwood. He has details. Larry.
TANYA, Cincinnati police, they're still talking with those grandparents of the man that was arrested. You can take a look here earlier, a few hours ago. Here's why. Police officers armed walking around surrounding those grandparents' home on Safer Street looking for 32-year-old Anthony Raby. He drove here with his 11-month-old son Solomon around 1 o'clock this afternoon. Earlier, over on Mozart Avenue, police say Anthony Raby got into an argument with, then shot his ex-girlfriend's current boyfriend. That man is in critical condition. Police considered sounding an Amber Alert, then tips rolled in. Within 2 hours, they had both Raby and his son.
Very grateful for the location of Solomon and glad to hear that he's in good condition and is a safe place now.
Tonight, officers took Solomon to be with his mom. No word yet on what charges Anthony Raby will be facing. He did meet with detectives tonight before being taken to jail. In Westwood, Larry Seward, WCPO 9 News.
All right, Larry, thanks so much. A house fire in VV leaves 6 siblings dead. We first reported this over the weekend. Investigators call this a complicated case because of how bad that fire was and how many people died. WCPO 9 News reporter Raven Richard tells us where that investigation stands now.
Aside from the names being released over the weekend, very little has changed. And I did learn from the state fire marshal's office that at least one smoke alarm was in the house, but it's too much damage to determine if there were more. 6 siblings, 25-year-old Paige Reidner, 15-year-old James, 13-year-old Jordan, 12-year-old Joshua, 11-year-old Emily, and 10-year-old Elizabeth died after the house they were in caught fire.
Investigations like this take quite a while to, gather all the facts, all the information we need to make a conclusion of what actually occurred here.
We do know neighbors next door tried to help, and the boyfriend of the eldest sibling, Paige, escaped the house fire. Sergeant Stephen Wheelis with the Indiana State Police told me this is a combined effort with the state fire marshal's office.
They're going to take their time and investigate it thoroughly, collect some evidence.
Not all the siblings were biologically related. I did speak to a woman on the phone who says she's Paige's biological mother. She described her as a ray of sunshine for everyone around her. I reached out to the local school district here to see if they could tell me a little bit more about the younger victims, but they declined. But I did receive a statement from the Reidner family. They are expressing their pain right now. In VV, Raven Richard, WCPO 9 News.
Cincinnati police arrested a suspect following a chase that is on foot. This started about 1 this afternoon with a call to Norwood police about a suspect sitting in a stolen vehicle parked in the Collard's driveway. And when officers caught up with that suspect, police say he took off running. Cincinnati officers were called to assist. A Cincinnati police officer ultimately arrested that suspect. No officers were hurt. 35-year-old man was shot and killed in Westwood, though, last night. Derek Terry was found dead on Westwood Northern Boulevard. This was near an apartment building. Police say he suffered multiple gunshot wounds. However, police have not given out any information about possible suspects. But if you know something that could help out here, call Crime Stoppers at number 513-352-3040. The Taste of Cincinnati has been postponed, but you can still enjoy some of the fun this weekend without leaving your couch. That story is next at 5. Steve.
Tanya, as we look at things, we had 61 today, so it was a seasonal day. The clouds are starting to roll in. Some changes set in your 7-day, and I'll have it for you on the other side of the break.
The Taste of Cincinnati, well, this is last year, right? It's now postponed from Memorial Day weekend to July 4th weekend. Organizers announced the change today to help stop the spread of coronavirus. This weekend, though, the Taste is moving online, and you can get a first look from the comfort of your couch. WCPO 9 News reporter Whitney Miller explains.
Organizers tell me pushing back the Taste was a big decision, but they say with the help of vendors and restaurants chipping in virtually, they'll be able to give taste goers a new experience. Every year, many look forward to the Taste of Cincinnati.
It's a huge undertaking for the city, and so there's a lot of planning and effort that go into that.
Matt Cuff over at Just Q and Barbecue got his first Taste experience as a vendor last year.
But it's still a big effort in terms of labor, in terms of how much food we need to prepare.
But now things are changing because of COVID-19. The Taste is now moved from the end of May to 4th of July weekend.
In probably early to mid-March, we started thinking about the fact that we would have to probably look at moving Taste of Cincinnati in general out of the May timeframe, just everything going on.
Lori Salzarulo organizes the Taste. She says since the new date is months away, it gave her team the idea to do something now virtually that would help drive business to local vendors and restaurants. April 3rd through the 5th, the Taste will go live online.
It will be built into one entertainment schedule, so all of the live music, all of the cooking demos, and then all of the beer. It could be brewer talks. It could be talking about pairing up their beer with different food ideas.
The idea is to get families connected over the internet and ordering takeout from participating restaurants.
Anyone that is open, and most are, you can see where their carryout hours are, how they're delivering to you, how you can purchase gift cards, any incentives that they might be doing for the community and discounts.
Matt Cuff has already started planning his virtual brisket demo.
There'll be a lot of tips in there on some things you can do a little bit better or different just to kind of up your home brisket game.
In Walnut Hills, Whitney Miller, WCPO 9 News.
Well, the virtual Taste of Cincinnati also includes a virtual Eat and Run 5K, which starts Wednesday. You can register and complete the run at your own pace. There's more information on our website. We want to hear how your business is innovating right now. It's part of our We're Open coverage. You can read more stories like this on WCPO.com. Folks, we do want to take you now to Kentucky Governor Andy Beshear, who holds his news conference at this time each day. I will tell you, he has told us, we were monitoring it, that the 1-year-old who was ill with the coronavirus in Fayette County is now home and in good condition. Now let's listen to what the governor's saying now.
Next couple weeks, folks, are really, really critical. And the amount of social distancing we do and the amount of contacts that we can decrease is going to make a huge difference on what we're going to see going forward. And I believe that you out there are doing well. I mean, we need to do better. We have to do better. I mean, the lives and health of our people depend on it, but you are working really hard at it. I want to show the CDC's map as of today. So this is what the CDC shows for our country. And as you can see, at least as compared to most of our neighbors, you are working very hard. And that's one of the reasons today that I have issued a new executive order that instructs Kentuckians not to travel to other states, but for a very few small exceptions. As you can see, Right now, we have more cases in other states. That doesn't mean that they're doing a good or a bad job. What it means is your likelihood of getting infected and potentially bringing back the coronavirus may be greater in other states than ours right now. And really, you need to be at home. You need to be healthy at home anyways. So to give a little more detail on that, I've asked my Chief of Staff, Latasha Buckner, to talk to us.
Thank you, Governor. So the governor's given the reasons for these new directives, and we want to kind of focus on some of the things that you can still do. We want you to go out of state if it's required for your job. We want you to go if it's you're on the border and you need groceries or medicine or other supplies that are necessities. We want you to go out of state if it's required for your health care. If you have a loved one that you need to care for, someone who can't leave their home, we want you to travel for that. And if a court requires you to travel. What we don't want is your favorite barber is across the state line. We don't want you to go for that. The weather's turning really nice. We don't want you to go for pedicures. We want anyone from Kentucky who's been out on spring break or for a trip.
You've been watching the Kentucky governor's news conference. Big news coming out of that, I should recap real quickly, is that they are giving a new directive. You are not to travel out of the state, and this is important for everyone in northern Kentucky unless it's for your job, for your health, or for your family. So they're saying do not do it otherwise, and that's a new directive from Governor Beshear. Let's turn now to the weather, and it was, still windy today, but pretty nice outside. I hope you got to enjoy just a little bit of it. How about you, Steve?
Yeah, I did actually get out and enjoy a little of it when it was sunny back earlier today, but you're right. The main feature has been the winds around here. We've seen some wind gusts of 30, 31 miles an hour. In fact, this past hour, that's been the case up in Wilmington. You'll notice we've got sustained winds to 17 right at the moment, along with that temperature of 60 degrees. Let's give you a little idea of what's going on here after a very mild weekend. We were at 81 on Saturday. Sunday was 67, 61 today, and you'll see my forecast for tomorrow at 48 degrees. So yes, significantly cooler and certainly a little cooler than average too. Average is at 58 degrees. Tonight we're still going to feel pretty mild weather in the 50s. The winds will start subsiding here in the next couple of hours. We're going to drop into the 40s as we head close to the overnight. Now let's go to the maps and show you what's going on as we look at things. What we've got is a lot of clouds around here more than anything else. As I set it in motion for you, you'll notice the green on the screen in the southwest starting to make a move toward us because of that rainmaker, that low that's to the south. So that low is going to continue to press that far south, and we're going to be right on the edge of it. So as a result, you folks in northern Kentucky will see the best chance of a shower tomorrow, but only running at about 30-40% or so. I think everybody north of the river will just see some mostly cloudy skies. Watch what happens now as that low continues to head out. We stay with some clouds at least initially on Wednesday, but then that high that you see scooting in here to the northwest is going to start drying us out a little bit. We'll see at least a little bit of sunshine about midweek or so, and temperatures will warm for us. But let's finish out what's going on here. And as we do that, of course, green on the screen means rain, and I really don't see much as we head toward the end of the week, at least not until about the weekend. Watch as I push it here right towards Saturday and Sunday. A low is driving north, and we're going to see a slight chance of maybe getting a couple of showers Saturday and Sunday. Saturday, in fact, looks to be maybe the best chance to see any rain even this week. 38 degrees in Cincinnati, and temperatures in the 30s overnight for tonight. And as we look at things for tomorrow, because of the clouds, the cooler air out of the north will likely not even hit 50 in most neighborhoods. So if you're getting a little walk in tonight, it'll be a nice evening, as I pointed out, 38 there, and we're looking at the clouds continuing to build up in the forecast. Then for tomorrow, I'm looking at mostly cloudy skies, as I say, mostly north of the river, and that slight chance for a shower with temperature 48 degrees in Cincinnati. So my 7-day forecast, it's still a little slightly cooler on Wednesday at 54. By Thursday, you'll notice end of the week, we're looking at least at some sunshine there, and temperatures in the 60s. As I mentioned, though, it does look like our next best chance coming up on Saturday in the forecast, Tanya. It has been really mild around here, and certainly this weekend, with the exception, of course, we had that real issue Saturday night with some severe weather.
Yeah, it's been pretty great overall. Thanks, Steve. Thrown in the mix, the class of 2020 is being fast-tracked into the fight against the coronavirus. At 5:30, we catch up with some recent nursing school graduates who will soon be on the front line. The search for drugs that could help COVID-19 patients has created a shortage of crucial medications. Next at 5, what the Ohio Pharmacists Association is doing to combat the pill hoarding. The desperate search for drugs that could help coronavirus patients has created a growing shortage of crucial medications for those suffering from lupus and arthritis. The Ohio Pharmacists Association reported a huge run on the drug hydroxychloroquine. This came shortly after the president announced that that drug showed some promise in the treatment of COVID-19 last week. The Pharmacy Board was then forced to issue stricter standards in the prescription of the drug after some doctors were accused of fraudulently starting to prescribe and hoard the drug.
We're seeing prescriptions from veterinarians. We're seeing prescriptions from dermatologists who have no business prescribing these drugs.
Well, meanwhile, the FDA has issued an emergency use authorization for the drugs chloroquine and hydrochloroquine to treat COVID-19 patients. However, there is little research showing they're actually effective against the virus. The FDA is calling for random clinical trials to determine how effective these drugs are. Trouble continues for people applying for unemployment. Consumer reporter John Matarese has a few suggestions for getting through, plus an update about that stimulus check from the feds. A program is helping hundreds of Hamilton County families working to lift themselves out of poverty. But is it ready for the economic devastation the COVID-19 outbreak has created? That story is coming up next.
This is WCPO 9 News.
Thank you so much for joining us at 5:30. Let's take a look at some of the national COVID-19 news right now at this hour. Navy hospital ship is now in New York Harbor as the city and state deals with a surge in patients at hospitals amid the coronavirus outbreak. However, this ship will not house COVID-19 patients, according to Governor Andrew Cuomo. Instead, the USNS Comfort will help other sick people. The ship has 1,000 beds, 12 operating rooms, as well as radiology suites, a lab, and also a pharmacy. About 1,200 medical professionals will provide care.
The last time this great hospital ship, all 70,000 tons of her, was in New York was in the wake of 9/11, where she served as a respite and comfort for first responders working around the clock. Today, like then, we bring a message to all New Yorkers. Now your Navy has returned, and we are with you, committed in this fight.
Now, part of Central Park has been turned into an emergency field hospital. Take a look to help fight this pandemic. According to the mayor, it is expected to be up and running by tomorrow. Another hospital also set up at Manhattan's Convention Center. People without coronavirus symptoms will be sent to that location. While we are seeing the number of virus cases rise rapidly in some areas, other parts of the U.S. are relatively untouched by the virus. In fact, about a third of the U.S. counties have no cases at all, according to data from Johns Hopkins University. That's likely because social distancing was already part of a daily life there. The majority of the virus-free counties are large and rural areas. However, these counties also tend to have larger populations of people older than 60 and fewer healthcare facilities. Health officials are pushing to get more testing in those areas to catch outbreaks before overwhelming those rural health networks.
Macy's says it will furlough the majority of its 130,000 workers. It includes their other brands like Bloomingdale's as well. Macy's stores have been closed since the 18th. Macy's says employees will continue to receive health benefits, though, at least through May. The company adds it expects to bring colleagues back on a staggered basis as business resumes. Having more boots on the ground in this pandemic. It is one of the reasons Governor Mike DeWine, for now, suspended a law that requires newly graduated nurses to pass a standardized test to get a license to work. Many of those testing sites aren't even open because of the global health crisis. And nurses who finished their coursework can fill a need. I spoke with a woman who graduated 2 weeks ago. Is this kind of a baptism by fire?
I mean, just because of the pandemic itself, I think is, we're definitely going in at a really crazy time.
But that isn't stopping Tabitha Rudolph. She's one of 200 Ohio graduates from the Hondros College of Nursing who can work now. 90 of them are in the tri-state region.
This is truly testing their ability to make a difference in people's lives.
It most certainly is, and we know that because of places that are much further along in caseload. This is CNN video from a hospital in New York, a state that's home to more than 66,000 confirmed COVID-19 cases and more than 1,200 deaths.
We're fighting for your lives and we're fighting for our own lives. We're trying to keep our head above water and not drown.
They've had struggles with protective gear. They've had to convert wards to accommodate coronavirus patients, and they've had to expand their morgue with refrigerated semi-trailers. It's that bad. You also see stories of medical professionals who've caught COVID-19 and lost their lives. When you're sending graduates into what some have called a medical war zone.
It does. But anyone that gets into the healthcare profession, whether that's a physician or a nurse or a STNA, they did it because they want to make a difference.
We're here to touch lives, and so getting us out there and getting us on board, I feel, is a great thing.
The Ohio Board of Nursing says there are an estimated 4,000 to 5,000 nursing students who would be eligible to take a